Thank you so much for joining us today to talk about the importance of mental health. SNAP teamed up with Active Minds to host the first ever Club Unity Summit to give students the space to step away from our day to day and have a real, honest conversation about what we can do to take care of our mental health. I'm here today alongside my friends as a board member of Club Unity. We are a group of athletes, actors, musicians, creators who are opening up and being honest about our own ups and downs with mental health. It's hard, it takes work, just like I had to commit to practicing on and off the court. In a world that's seemingly so connected by our phones, it's still easy to feel alone. But today, we hope you will recognize the community that is here to support you on your own journey with mental health. No one is truly alone, and we can all do our part to help one another. I'm here for you, Snap is here for you, Active Minds is here for you, and we are all excited about our time together today.
Hi, everyone, and welcome to the Club Unity Summit. Thank you to the team at SNAP for hosting this exciting event, and thank you to so many of you for joining. My name is Allison Malman, and I am the founder and executive director of Active Minds. Many of you may know that I started Active Minds at the age of 22, having recently lost my brother Brian to suicide. Now in our 19th year, Active Minds is leading the conversation and inspiring action around the mental health of young adults throughout the nation, on campuses, in workplaces, and in communities. And we are so thrilled to celebrate with all of you today our new partnership with Snapchat. Active Minds is incredibly grateful to Snap for supporting our growth and ability to positively impact the lives of young adults across the country through mental health programming. Together, and with the help of Club Unity, who you'll get a chance to know throughout today's program, we are uplifting the message that we are here for you through the Snap platform, through the work of our chapters and communities all over the country, and so much more. As part of our inaugural year of Club Unity, we've begun a multi-year partnership with Snap. Our partnership will support the expansion of Active Minds chapters at community colleges, HBCUs, and high schools, with the goal of reaching a larger number of Black, Indigenous, and people of color and LGBTQ+ students. I cannot wait for all of you to experience it. For now, please enjoy the event, and it is now my pleasure to welcome Active Minds student leader Jaden Singh to kick things off.
Thank you, Allison, and hello, everyone. My name is Jaden Singh, and I'm a member of Active Minds National Student Advisory Committee and a sophomore at the University of Arizona. I was so excited to learn that Active Minds and Snapchat were joining forces to put together this exciting event to elevate and uplift the pressing topic of mental health. Since starting to learn to navigate my own mental health, I've been proud to dedicate myself to the movement here at Active Minds to help other young adults do the same. Through Active Minds, I've learned that we are never alone, no matter what we are going through, and that the world always needs each of us here. This work has shown me that our voices are the key to letting each other know that we're here for each other, and I am so inspired and grateful to hear from Club Unity and all of you today. The past couple of years have been challenging, and if you're like me, you're feeling positive and hopeful that things are looking up, but also feeling the need to take some time to care for yourself and to connect with others who also are looking to prioritize their mental health and well-being. Over the next couple of hours, we have the opportunity to do all of that and more, and I invite you to participate in whatever way feels the most comfortable to you. If you're new to Active Minds, please feel free to visit us at activeminds.org and reach out to me at any time, and I'd be happy to share more. Without further ado, it is my pleasure to introduce our keynote speakers today, SNAP CEO Evan Spiegel and the U.S. Surgeon General, Dr. Vivek Murthy.
Hey, everybody. Thank you so much for joining us today. It is an incredible honor and pleasure to introduce America's 19th and 21st Surgeon General, Dr. Vivek Murthy. We're so grateful to have you here with us today.
Well, thank you so much, Evan. I'm really looking forward to our conversation, and I'm so happy that we're here to talk about mental health, which is a subject I care deeply about.
You've been such an incredible and passionate advocate for mental health. And I just want to thank also our partners, Active Minds, and of course, Club Unity for bringing this event together and for all of their support on such important topics. So I guess maybe before we dive into the great questions we received from the students, perhaps you could just share a little bit of your own personal journey. I mean, how did you end up as the Surgeon General? Why are you so passionate about mental health?
Well, Evan, I'll tell you, it wasn't because it was part of a 5 or 10 year plan. In fact, when I was a kid, I remember seeing C. Everett Koop, one of our former Surgeons General, my predecessor, on TV talking about smoking and HIV. And I had a great respect for his work, but never thought I would serve as Surgeon General one day, or much less serve in government. So it was a bit unexpected. I was training in medicine. I was building a technology company at the time, and was really interested in technology. I was getting involved in health policy advocacy related work, but all from the outside. And it was quite unexpected one day that I got a call from then the Obama administration asked me if I would be interested in serving as Surgeon General. But I found that it was an extraordinarily meaningful opportunity to serve, but one that interestingly brought together much of my background in technology and public health and advocacy in community organizing, and of course, in medicine. Mental health became early on an important area of focus for me for a couple of reasons. Most importantly, because it was what I was hearing time and time again from people all across America as I traveled our country and went to big cities and small towns, spoke at schools and at universities, as well as at workplaces and government buildings. And I just kept hearing again, sometimes in said, sometimes in unsaid ways, that people were really struggling with their mental health and well-being. They were worried about the mental health of their kids, of other people in their life. And they were also struggling with loneliness, which was a profound challenge for people and continues to be, especially during this pandemic. But they wouldn't say things like, I'm really struggling with my mental health, or I'm feeling lonely. People would say things like, I feel like the burden of everything that's happening in my life is almost too much to bear, or I feel like I have to deal with it all by myself, or if I feel like I disappeared tomorrow, nobody would even notice. Hearing this again and again really helped me understand that there was something deeper that was happening in our country beyond what I was seeing and had seen, in the hospital treating patients with physical illnesses. And frankly, it reminded me of my personal experiences also, just as a child struggling with loneliness and with other mental health concerns. And then later seeing, among the patients I cared for in the hospital and in clinic, that there were far more people who were struggling with their mental health than I ever anticipated when I was in medical training. So putting it all together, I came out of that experience as Surgeon General the first time, recognizing that our mental health is not only such a critical part of our overall well-being, but it is a part of our health that we're really struggling with. And we're often, that a lot of that struggle is taking place behind the scenes, if you will, behind the curtain. People aren't talking about it as much as they do about physical illness, which means that we are not able to acknowledge what's happening to us, much less get the help to people that they so desperately need.
One of the things that you worked on was a book called Together, The Healing Power of Human Connection in a Sometimes Lonely World, which I believe talks a bit about some of the topics you just addressed, especially around loneliness. Can you talk a little bit about what you learned in the process of writing that book?
Yes, well, I learned so much, both, and a lot of this again stemmed from those incredibly enriching conversations I had with people across the country, both when I was Surgeon General and afterward. And they taught me were really two critical things about loneliness. One is that it's incredibly common, but the number of people who struggle with loneliness is far greater than the number of people who have diabetes in our country. Yet we wouldn't know that based on the news that we read and the conversations we have. The second thing I learned was that loneliness is consequential for our mental health and for our physical health. It turns out that people who struggle with loneliness are at higher risk of depression and anxiety, but also at higher risk for heart disease, for premature death, for dementia, for sleep disturbances, and the list goes on. And so putting those together, I came to realize pretty quickly that we have a profound challenge on our hands that we have to address. And that's a challenge in the crisis of loneliness. It's not unique, by the way, to the United States. Many other countries have noticed similar trends in the UK and Australia, in other parts of Europe. Around the world, people have noticed that double-digit percentages of their populations are struggling with loneliness, and it's having a real impact. It also has an impact, by the way, not just on your health, but on productivity in the workplace and creativity and retention. It has an impact on how kids do in school and on how we show up for our family and friends. So it became clear to me that loneliness is a public health crisis. It's a challenge that we can meet, but to first meet it, we have to acknowledge it. And that means that for many of us, we have to recognize that it's a challenge in our own life and that it's okay, that it doesn't mean that we're broken or socially deficient in some way, if we struggle with loneliness, all of us at some point in our lives will struggle with loneliness. And it's not about the number of people you have around you. It's really about the quality of your relationships. It's about how open and vulnerable you can be with others. It's about how much of yourself you can truly bring to your relationships and your conversations. And that is where I think we have more work to do, more benefit that we can gain, and more connection ultimately we can build in people's lives and across society.
One of the things that you mentioned is, how many people are struggling with that feeling of loneliness. Do you have advice for those of us who have friends or family members who are struggling with mental health issues? What can we do to help? What are steps that we can take when we see, a friend that's really struggling?
Yeah, it's a great question. I'll say this as somebody who myself struggled with loneliness for many years and has experienced that, in bouts and during adulthood as well, including when I served as Surgeon General the first time. But I think the good news is that all of us can do something to assist with addressing loneliness in the lives of others and in our own lives. And you don't have to be a doctor or a nurse or have some public health training in order to respond. You just need the willingness to show up as yourself and to be present for others. But here are a couple of concrete things that help. So number one, making sure that you spend at least some time each day reaching out to people you love, even if that's 10 or 15 minutes, can make a huge difference in your life. That could be 10 minutes that you spend making a phone call on the way to work. It could be 10 minutes that you spend writing an email to somebody that you've been out of touch with for a while. But that 10 minutes matters. The second thing to remember is that the quality of our time with other people matters. And that means that being present, giving people the benefit and the gift of our full attention can have an extraordinary impact on the conversation. If you've ever had the joy, Evan, of being in conversation with somebody where they were fully present, where they were listening to you with their full attention, where they didn't have their phone distracting them, where they weren't trying to tick through their to-do list, for work at the same time, but they were truly fully present with you. You know what a gift that is and how beautiful it feels. And 5 minutes of fully present conversation can often be more rewarding than a half hour of distracted conversation. And the third thing I'll mention that can be very powerful to connecting us with others is actually service. And this was an unexpected lesson for me. But it turns out that when we seek each other out for opportunities to serve, we not only build a bridge to someone else, but we remind ourselves that we have value to bring to the world. Now, why is this so important? Because it turns out that one of the great consequences of loneliness is that it chips away at our self-esteem. Over time, it makes us think that the reason we're lonely is that we're not worthy, that we're not the kind of person that people would want to spend time around, that we're not fun, we're not entertaining, we're not handsome or beautiful, like we're just not good enough. And over time, we can come to internalize that. But when we serve other people, we're reminded that we do have something beautiful and beneficial to bring to the world. And so acts of service, as counterintuitive as it might seem, you might think if I'm lonely, I need somebody to engage with me, not me to go and engage and try to serve somebody else. But it turns out that is one of the most powerful antidotes we have. So these three acts are very, very simple things that we can do. And service, keep in mind, doesn't have to be going to a soup kitchen and donating your time. Service can be reaching out to a friend who's struggling and offering them your ear. It can be getting food delivered to a fellow parent who might be struggling to homeschool their kids and get their kids back and forth to school if they're in person, and make sure that they're teleworking and doing all that at the same time. There are many ways that we can serve. And finally, I'll just remind people of this, Evan, that these are deceptively simple solutions. Because it turns out that we are hardwired as human beings to connect with one another. And when we give ourselves just a little bit of an opportunity, a little bit of freedom, a little bit of permission, if you will, to reach out, to be vulnerable, to be open with others, then our system responds. Our body craves that kind of connection. Sometimes we have to get through our own inhibitions, and our own and the stigma that we may have internalized around loneliness or reaching out or being vulnerable. But that is really who we are. We're meant to be connected to one another.
Well, it's such an inspiring message, especially for the team of young people that came together as Club Unity to try to make a positive impact. So thank you so much for that. One of the things that you just mentioned about stigma really connects to a question that one of the students asked. So let me jump to that question for a second here. Kiana Victor, a student at Randallstown High School, said that mental health is a significant stigma in many communities, and especially with older generations, which often challenges students who seek emotional support. So what do you think a student should do if they're facing these challenges, and how can they, get help if maybe, they're having trouble finding that in their community?
Well, let me just tell you, I deeply resonate with that question because many of us, myself included, come from cultures or communities where mental health is looked down upon or shoved into a closet, and looked at with some degree of embarrassment. I remember when I was in high school and I found out that my uncle had taken his life. I was actually the first one to find out. And I remember just the shock of that moment and calling my parents and talking to them and having to, all of us then call relatives in India and explain what had happened to my uncle. And this sense of shame that I remember feeling from that the extended family was really palpable. People didn't want to talk about what happened. They worried it would reflect badly on the family, and it would cause all kinds of other consequences. So that sent I think, a harmful message to me as a young person that it's not okay to struggle with your mental health. But I think the good news is that we know, in fact, that a lot of people struggle with their mental health. This is not just a problem of the few. This is a problem of the many. Is a common challenge, and hence has to be a common cause that we unite behind. And even if you're from a community or a culture that doesn't acknowledge or readily embrace, speaking openly about mental health and seeking help, I think it's important for you to know is that if you're a student on campus, if you are working, in the community, that there are very likely people around you who are struggling too. And being able to, number one, share your story, openly with a few trusted friends, even if they're not from your community, that can be a very powerful and very liberating, can also give them permission to step forward and share their story. And every day, more and more people are stepping up to share what their struggles are with mental health. You see it certainly in the papers with athletes, like Naomi Osaka, Simone Biles, and others speaking courageously and openly about what they're dealing with. But it's happening behind the scenes as well, in workplaces, in schools, on university campuses. The second thing I think I want to emphasize to you is that seeking help in terms of counseling services, which are often offered through health plans on campus and also through health plans that people get from their workplaces, this is not at all something people should be ashamed of. Counseling can be one of the most powerful and empowering steps that you take to help you think through the challenges you're dealing with, to help process some of what we are all going through, especially during this pandemic, which is an incredibly hard time. So don't feel that you're somehow conceding or giving in if you're seeking counseling. It's a very powerful step. I think of it in some ways as like signing up to go to the gym. When we sign up to go to the gym, you don't think, oh gosh, I'm throwing the towel in. I can't exercise and get fit on my own, so I got to sign up for the gym. Like, we don't really think about it that way. We see it as a positive step that we're taking for our physical fitness. And seeking out help in the form of a counselor or other services is very, very similar. So I would think about it that way as well. And finally, just recognize this, that, over our course of our life, we're all going to go through mental health challenges. What makes a difference, often one of the factors between those who manage to not only survive despite those challenges, but thrive, are the people who are willing to speak up, to seek help, to confront the challenges that they're dealing with. The longer we don't confront them, the longer they persist, the more deeply they can affect us. But on the other hand, if we address our mental health challenges early on, we can actually turn them into strengths. They can make us more open and vulnerable and able to connect with other people. They can make us more empathic and more understanding of the challenges that other people go through. And finally, just keep this in mind. The conversation we tend to have a lot is about mental health in the context of mental illness. But mental health is so much more than whether or not you have diagnosable depression or anxiety. It's much more than the absence of illness. But we know that our mental health and well-being exists on a spectrum. Part of that spectrum is illness. But we can also not have diagnosable illness and still not be doing great, right? We can be in a funk, if you will, for a prolonged period of time, just kind of feeling out of it, feeling drained emotionally. And so part of focusing on our well-being is not just, again, about preventing illness. It's about functioning on the optimal end of our well-being scale. And if we do that, we can not only feel better, but we can do better in our relationships, in school, and at work.
When I was younger, I really struggled with my parents' divorce, and counseling made a huge difference in my life. So I couldn't agree more, and it helped me think about my own experience and my own emotions really differently, which helped me as I got older. So I definitely think that's such an important resource. We have another great question here from Emma Smith, who's a student at Drexel University. And Emma asked about the intersection between mental health crises and other public health crises facing our country. I think in particular, the addiction crisis, which is something that you've spent a lot of time working on. Do you mind sharing your thoughts about this and how we can have more of these conversations about the intersection of many of these issues?
Well, it's such a good question that she asks, because there is a deep connection between our mental health and our physical health. And we've learned that over the years. I saw that firsthand as a doctor. And if you think about the physical challenges that we're dealing with, whether it's heart disease or diabetes or obesity, we know that our mental health has a real impact, on these conditions, and that when we do better in terms of our mental health, we're often able to do better in terms of sticking to a care plan, let's say for our physical health, whether that's taking our medications or staying on an exercise plan or staying on a diet plan. These things are better when our mental health is better. On the other hand, when we are struggling in terms of our mental health, it makes everything harder. And we've seen that, up close. So many times I recognize, and when I was, practicing and I was in clinic and in the hospital, that sometimes what a patient needed when they weren't taking their medications was not another reminder of the importance of taking their medications. They often knew that, but there were often other struggles that they were dealing with in their life, which drained them energetically and made it harder to really focus on some other aspects of their physical health. The other thing, though, I would note, though, which is more of a biological connection, is that when we are under a great deal of stress, whether that's because of circumstances in our life or loneliness or other such factors, that stress in the short term, sometimes stress can be beneficial. Can motivate us, for example, to get a presentation together, to for a job interview, for an athletic performance, a race or something we may be getting ready for. But in the long term, stress actually can be destructive. It can increase inflammation in our bodies, which can lead to damages to our blood vessels and our tissues, and increase our risk of chronic illnesses, including cardiovascular disease. So we know that chronic stress, which can often accompany stressful situations, loneliness, and other mental health conditions, can have a deleterious effect, on inflammation and on disease, genesis down the line. So there are umpteen reasons to now that we now understand why there's such a deep connection. So the bottom line is, if we want to be healthier as a country, we want to lower our rates of heart disease and obesity, as well as improve our mental health and well-being, it makes sense to focus on our emotional well-being and to ask ourselves the question, how can we do better in terms of preventing mental crises and mental illness? How can we build stronger social connection, recognizing that it is our bonds with one another that are the foundation on which we build our health, but also everything else, our relationships, as well as our performance in work and how we show up in society.
One of the real crises that we've been working on here at Snapchat is the fentanyl crisis, where young people sometimes who are struggling with mental health issues think they're experimenting with a prescription pill that might make them feel differently. And instead, that pill is laced with fentanyl and can lead to death. And when we've been communicating with our community about this, we found that a lot of young people don't even know about fentanyl. They don't know about the risks. They don't know that a amount of fentanyl equal to a grain of sand can be lethal. So what are some of the things that young people should know about fentanyl? How does this intersect with the mental health issues that you and I have been discussing? And what can we do as a community to make sure that young people are not dying from fentanyl?
Well, it's such an important question, Evan, because we've been struggling with an opioid crisis for many years now, and fentanyl is one of the more powerful opioid medications, which unfortunately has led to the death of many people in our country over the last several years. And often it gets, as you mentioned, it spikes essentially other products. And so a lot of times people don't even know that they're taking a product that has fentanyl in it, and they don't recognize how powerful what they're ingesting is or inhaling is. So a couple of things I get to know. One is there is a very strong connection between our mental health and substance use disorders. We see that overlap all the time. And when people struggle, in fact, with greater depression and with bouts of anxiety, when they have increased stress in their lives, that can often be a trigger actually for a relapse, a reason for them to turn to substances, in part to numb the pain that they feel. And so while it's understandable, it's extraordinarily harmful. And so it's yet another reason why it's so important we address some of these upstream factors that drive our mental health. But the other thing that's really important to know when it comes to not just fentanyl, but opioids more broadly, is that these are highly, highly addictive substances. You may know people who have had them, and maybe they did okay. They got through, a round of opioids after they had a surgery or something and had opioids for pain. But we now know something in with much more clarity that we didn't understand as fully 20 years ago, which is that these are some of the most addictive substances that we prescribe, and that none of us can assume that we are going to be immune from the addictive potential of these medications, that we can somehow just try it a couple of times and we'll be fine. But these have real serious consequences. And so one, for recreational purposes, I would really caution people against using these medications. They are harmful. I have seen up front how they tear people's lives apart and tear communities apart. I've seen promising young people who are extraordinarily talented lose their potential, their lives, their family, their relationships because of opioid use disorders. So I would treat these with medicines with respect, and certainly they're not recreational in nature. Second, even if you do need opioids for medical purposes, it's important to be informed and to be able to have a conversation with your doctor about whether there are alternatives to those pain medications. And if there are not, if you need that level of pain medication in your life, to ask what's the shortest possible course you could take. Because again, the shorter you remain on these opioid medications when they're prescribed, the better it is for you. And finally, I just remind people of this, that sometimes some of the most powerful advice that you can get comes from your friends. And that means that you are an incredibly important resource for the people in your life. And if you see people using or misusing these substances, never hesitate to have a conversation with them if you're worried. And I know that's hard, right? It feels like you're butting into someone else's business, that you're being nosy, that you're somehow being preachy with them. But let me tell you this, of the many people that I have known and cared for who have lost loved ones over the years to opioid use overdoses, so many of them wish somebody in their loved one's life had thought to say something early on when they first noticed that there was a problem. So never doubt that it's a conversation that you have with somebody, with a friend who you see is having a hard time or misusing opioids. That conversation may be one that helps save their life. And that's the only way we get through crises like these. It's not just by doctors and nurses talking about these public health issues. It's by each of us looking around us, the people in our life, and speaking up when we see a problem, reminding people that we are there to support them, even though the crisis with the opioid use disorder is a fierce one. But it's one that we know we can get through. There's medication that helps. There's counseling services that help. We have more experience with that now than ever before. We know it saves lives. We just have to help people get that help. And that's where all of us can come in and help the people we love, who may be struggling.
One thing I'd really love to hear your perspective on, I know our community is really interested in, is the role that internet platforms can play in mental health. I mean, it seems like there's probably a positive role based on some of the comments you made earlier about people being able to connect with friends and build deeper relationships. There's also probably negative, impacts of internet platforms as well. Do you mind just talking a little bit about some of those positives and negatives and how you view the role of internet platforms in mental health?
Well, absolutely, Evan. And I'm glad you asked, because it turns out that technology at the end of the day is a tool, right? It's how we use it that determines whether it helps us or whether it harms us. And I think that there's a lot of benefit that people can get in their lives from social platforms, the opportunity to find a community where they may not have one, to share experiences in initially safer settings, to find resources and help, and to build relationships. That can all be very, very positive. But a couple of things that I do worry about. One is that in order to really achieve those benefits, we have to be very thoughtful in how we design social platforms. So number one, we have to, from the beginning, know what our goal is, right? And if our goal is to help support the mental health and well-being of people, to help them build healthy relationships, then we have to design our platforms and design from an engineering to a front-end design perspective in order to achieve those ends. What I think is much more problematic is if we build platforms that ultimately do a ton of harm and then try to set up side programs for people who end up having problems in the end, to say, okay, here's a resource to help you. To me, that's the equivalent of a tobacco company manufacturing cigarettes and then funding cessation programs on the side. The better thing is to not produce and sell the cigarette in the first place. And so I think that engineering our platforms with an idea in mind initially of how we enhance and contribute to mental health, positive mental health, I think is one piece. think the second has to do with data and with data transparency, which is that there's a tremendous amount of data that social platforms collect, a lot of which speaks to the impact that they may be having, the sentiment essentially that their consumers and that their users are experiencing at a given point in time. Being able to understand what kind of sentiment we are generating, what kind of experience users are having is really important, but making that available for researchers and the public to understand and analyze independently is also very important. It's not just important for the overall outcome, but in this day and age in particular, where we've seen so much harm transacted on certain social media platforms, it's important from a trust perspective to make sure that the public understands that, okay, we can trust a company because it's being open and transparent with its data. And the third thing I'd say has to do with misinformation. We know, unfortunately, that misinformation in general about health is not new, right? People have been trafficking in misinformation for generations. But what is new is the speed and scale and really sophistication with which misinformation is spreading. And it's having consequences for our health. There are people who have consumed misinformation about COVID-19, for example, and have been led to believe that it's no different than the common cold or the flu, and have lost their lives as a result because they didn't think it was necessary to take precautions. There are people who have turned away from the vaccine, COVID-19 vaccine, a vaccine which we know can save lives and has saved many lives already, because they ran into misinformation online, which told them that the vaccine somehow causes COVID itself, which it does not, or that it causes infertility, which it does not. So misinformation is a profound challenge that we face. And as we think, Evan, about how to prepare for the next pandemic, how to protect our health, guarding against the rampant spread of health misinformation will be top among the priorities that we have to focus on. And social media platforms are incredibly important here because we know that a tremendous amount of information is transacted on these sites, including misinformation. And so being thoughtful about how we proactively address that, how we ensure that algorithms don't end up inadvertently amplifying misinformation, making sure that we are there too being transparent with data so people know how much misinformation is being transacted and what interventions are working to address it. This is incredibly important for us to create social media platforms that contribute to a healthy information environment as opposed to what we have now, which I think is a profoundly unhealthy information environment, which is costing people their lives.
Perhaps we can end on a question from one of the students Kelly McGuire from Florida Gulf Coast University, who asked, what do you believe are the most pressing mental health issues today in the United States? And what steps do you think as young people we can take to create positive change?
Well, that's a great question. And I love this question because I think inherent in it is a note of optimism. And I'm an optimistic person. And I actually think I feel more optimistic about our chances of building a culture around mental health that's positive and uplifting than I ever have in my public health career. And I'll tell you why I feel so optimistic. It's actually because of young people in our country who have taken charge of having a conversation about mental health in their universities, in their workplaces, in their communities, and are driving that change forward. Evan, I'll tell you something that you know really well as a CEO, better than most people do, which is that culture is what drives a company, an organization, a country, right? Culture is more important than any policy you can put in place. It dictates what your real lived policies are. And when it comes to mental health, we have to change our culture, right? From one that says your mental illness is something to be ashamed of, and people who struggle with their mental health are weak, to one that says mental health is part and parcel of our overall health. And when we focus on it, when we speak up about our struggles, when we talk about how to strengthen our mental health and well-being, we ultimately make ourselves stronger and more resilient. And we create a community where no one has to feel ashamed or left out. How do you create that kind of culture, though? Well, that is, changing culture is one of the hardest things we do. But we change that conversation by conversation. We change that when people stand up and share their story with courage, when they call upon their universities and their employers to provide the kind of mental health resources that people need, which many employers are doing now, many universities are doing now, which makes me incredibly proud to see that shift, in workplaces and schools. And culture also changes when people see that there is help available and when it's normalized, the whole process of actually getting help, where going to see a counselor feels like going to the physical therapist. So this is how culture changes. And as we're young people who are out there, I just want them to know that you don't have to have a seat in Congress. You don't have to, sorry, just one sec, my kids have come home. So, but what I want young people to know is that you don't have to be a policymaker or run a major company for you to be able to change a culture on mental health. You just have to have the courage to share your story. You have to have the courage to call for change, to advocate for change. And that's what a lot of young people are doing. That's why I feel optimistic we can change our culture on mental health and ultimately create, I think, a society and a culture that's healthier and stronger because it embraces mental and physical well-being.
Well, just in time, wrapping up here now that your family is home. Thank you so much, Dr. Murthy. This has been an incredible inspiration and honor. And thank you so much for your service to our great country. We're just so grateful that you could be here with us today.
Well, thank you so much, Evan. And thank you for everything you're doing to advance the conversation on mental health and well-being. This is, I believe, one of the most important conversations of our time. And the changes that we make now will serve our country for generations to come, including my son who just walked in here, who got home from school. And he's a kindergartner, but my hope is that as he grows up, that he won't see mental illness and mental health struggles as something to be ashamed of, but he'll see it for what it is, which is part of being human and something we should all be able to talk about, a place where we can all help each other.
Well, thank you so much, and have a great time with your family. We really, really appreciate it.
Well, thank you so much, Evan. Take care.
All right, take care. Thank you.
Bye-bye.
Bye.
Thank you so much, Evan, not just for hosting that awesome interview and keynote, but also for creating this amazing, amazing event which is promoting mental health. We got together as 7 new friends with the broadest creative mandate to change the world. We've got humanitarian and former fashion model Halima Aden. We've got musicians and actresses Chloe and Halle. We've got actor Ricky Thompson, basketball player Trae Young, you heard from at the start, and of course, Maddie Ziegler. We started with how can we change the world? However we want. And we started with this question, wouldn't it be amazing if? And gang, can you guys remember, we started brainstorming wouldn't it be amazing if there was no climate change? What else did we say? Can you guys remember?
What if there was no gender-based violence?
Yeah.
Right.
What if we could end gun control?
Yeah, and gun violence, that would be
Gun
huge.
violence, sorry. That's what I meant to say.
We had all of these ideas, right? We were like, wouldn't it be amazing if we could create this world? And then we realized that a lot of the things that we were trying to fight for were actually getting better. Poverty around the world is going down. Childhood hunger and mortality is going down. The world is becoming a better place in so many ways. It's so exciting. But one thing that we all realized wasn't getting better was mental health. In fact, that's been getting worse year on year. And we're starting to see such crazy statistics, right? A suicide every 40 seconds globally. That means since I started talking, somebody has lost their life as a result of mental health. And the pandemic, for all of us, made things worse, and for people around the world, right? The sense of isolation, and a lot of us had these really distracting lives. We were traveling around the world. We were living this rock star lifestyles. And then suddenly it all went away and we're forced to confront ourselves. And I think so many people have gone through that over the last year and a half. And that's why mental health has come to the foreground. And I've heard Dr. Vivek, who we've just heard speak to Evan on the previous session, speak about 3 main lies that the modern world tells us. The first lie is that your self-worth depends on the money that you have. The second lie that we hear all the time is that your self-worth depends on how much power you have. And the third lie that we often hear is that your self-worth depends on how famous you are. And sitting with you guys on this panel and having met you guys over the last few months and having so many discussions, I realize that none of those things are true. Many of you guys have fame, you've got power, you've got money, and yet we're going through mental health issues together. We're going through many of the same mental health issues that so many people are going through that are listening on this session. I want us to be super open here. I want us to be super honest. We're not going to have any jargon or fancy words. We're going to share our journeys through mental health and hopefully inspire other people to do the same. As we heard from Trae at the start and even from Dr. Vivek, mental health's almost gone through a moment, right? We've seen massive global icons like Simone Biles, Naomi Osaka, who have brought mental health to the forefront and said it's okay to not be okay. And yet, in some communities, it's still a huge stigma and taboo. And Halima, I've heard you talk about this at great length, that in the Muslim community, in the Somali community, a community that's gone through wars, it's still this huge stigma and taboo. When you say that, what does that actually mean? What does that look like? And how does that impact young people today?
Yes, I think everything that you said is so incredibly important. My Somali Muslim community, mental health is absolutely a taboo. It's something we do not talk about. It's hidden, out of sight, out of mind. And I really hope that we can change that this year. I hope that by us doing this summit, coming together, being open and vulnerable with our own shared experiences, I hope that that will give people the okay to discuss mental health with their family and loved ones. But yeah, I grew up in Kakuma. Listen, it was a refugee camp. So we had to deal with infectious diseases, malaria, food shortages, long lines to get food rations. So much of my early life was about the physical well-being of the child, right? So it was about, do you have enough food? Do you have enough water? Do you have enough clothes? And then the older I got, the more I was like, oh my gosh, I'm the queen of distractions. And so what happened, I think, was for 23 years, I was like running, always distracting myself, always staying busy. I was a busybody. And then the pandemic happened, and I had, for the first time, pause. I've never really been able to pause. And so it was the first time that I was truly able to pause in my footsteps. And that's when it all came flooding. And that's when I decided, listen, career can wait, but my mental health cannot wait. So I decided to step away from a very successful modeling career and really just make mental health my number one top priority for the first time in my adult life. And so I'm so honored to be here. I'm in great company, and this journey has been so therapeutic for me. I don't know about the rest of you, but I feel like I honestly have grown with you guys, and my mental health could never be better.
Thanks so much, Halima. And I think there's this misconception that mental health is a rich people's thing. The reality is, when you look at research, marginalized communities are often disproportionately impacted by mental health illnesses, right? Being marginalized in itself creates all kinds of mental health illnesses. I think when we start to look at solutions, they need to be accessible. They need to hopefully be available to everyone. Ricky, when I think about mental health therapy, people often think of counseling and that kind of stuff, but it comes in many different ways. Having close friends is therapy. And I honestly believe what you do through your humor, your entertainment, it is therapeutic to millions of people every day. For me, that's a superpower, Ricky. How did you, or when did you realize you had that superpower? Were you always like this?
I was not always like this at all. I used to be literally such a shy kid. I was always quiet. I wasn't as confident as I am now. But I don't know. I mean, I just really started preaching about self-confidence, and I started really listening to myself, and it finally came into me, and I'm like, wow, I'm actually an amazing person. I'm everything. I love myself. And when you get to that moment, you just feel amazing. So yeah, it took a while to get here, but I'm here.
And we are so glad that you are. I think, Ricky, you use social media at its very best to empower and uplift and inspire, to make people smile through their mobile screens. It's a beautiful thing, but we often see the other side of the technology, right? And that sometimes isn't so sweet for mental health. And Hallie, Maddie, we've seen many faces of that. One of them is something that not just you guys as celebrities go through, but people that are watching right now go through, and that's cyberbullying, right? The comment section of some platforms can be so mean, for lack of a better word. How do you guys, and I'll start with yourself, Maddie, how do you start to deal with negative comments? Because people say ignore it, but surely it's not that easy.
Yeah, I would say especially because there could be, for instance, 1,000 good comments and there could be one bad comment. And of course, it's way easier to find that one negative and dwell on that for a while and get in your head and start to believe the things that people are assuming about you. And I think it's a really vicious cycle, and I think it stems from people kind of like projecting their own insecurities out on you. And I think like you said, it's so hard to ignore it. It really is. But I think now I've learned that I've gotten in the headspace of like, I want to share my life for my friends and for obviously all the supporters watching. And then once I do that, I kind of have to log off and I kind of have to take a step back because I'm posting what I love for myself and for my loved ones. And it's not worth kind of like dwelling in the negative comment section because it's not worth it and it's meaningless, honestly.
Yeah,
Definitely.
I absolutely agree with Maddie. I find that as I'm on this journey of discovering more of myself as a young woman and having to be, I guess you'd say, sort of in the public eye and have everybody watch what you do, I'm learning to just put my best foot forward and love myself and love what I'm doing. And as long as the people around me, my family, my friends have my back and kind of protect me in this little love bubble, then I know that I'm going to be all right regardless. And yes, we are human. Yes, comments hurt. What people say hurts. But what I've realized, especially recently, is that you can't please everyone and they will always have something to say. You know, I find it really funny how one week they could say something, whether it be about your hair, and then the next week you're like, okay, well, let me change my hair. So you change your hair, right? And then they find something else. So it's never going to be nothing that's said, and that has nothing to do with you because you're perfect in every way. It's always just somebody else's kind of projecting insecurities, just like Maddie said. So what I do, I just move forward in love and prayer, and I pray for them, and I pray that whatever hurt that may be lingering within anyone, I hope that it goes away because, you know, at times life can feel really hard. And, you know, I just definitely just want to continue to spread the message of positivity and love because that's what keeps us all together. And that's what makes us okay at the end of the day. So, yeah, I just keep my best foot forward and keep the ones that I love around me and reminding me that I am worthy and that it is okay and everything will be just fine.
That's such a beautiful idea. And Chloe, cutting straight to yourself, we were just talking about this idea that, you know, the comment section can be quite nasty and how we deal with that and cyberbullying as a whole. The other side of it for me is you know, we live in this world where, like, on these, like, I live here in the Gold Coast, Australia, and I only see people with six packs and amazing bodies, and I've got this, like, crazy expectation of what I need to be. But it gets even worse sometimes on digital, right? Where you start seeing this, like, this idea of, like, this immaculate image, and you try and achieve that. Chloe, how do you deal with that? You're in this space where you're constantly, you know, bombarded with people saying, look like this, dress like that. Where do you find that space to say, actually, I'm just going to be...
Where I find the strength, honestly, some days I don't, but some days I do. And where I find it is when I look in the mirror and I let myself know that this is greater than who I am. And I just have to love who I am deep inside so that I can take care of my brother and my sister and just try to be a good person and pay it forward. So I have to realize that sometimes it's more than either materialistic or external aesthetic. And it's all about really what's inside of your heart. So, yeah, that's how I kind of find the strength.
It's a beautiful idea. I think one of the challenges a lot of young people face is they want to talk to their parents or aunties or uncles about their mental health. But we realize that, like, our parents are not the same as us. They don't have the same appreciation for mental health often. Maddie, you've got a really unique situation, right? Because, like, you were in your stardom from the age of 10, 11 years old, working with adults, including your mom. How do you talk to different generations around mental health? And how does your mom's generation see mental health compared to how you see it?
Yeah, I think it was interesting because when I was little, I was in such a high pressure situation, especially as a competitive dancer, being told that if you don't win, then you're not worthy. if you don't win a medal or a trophy or a crown, you won't make it. And now I've learned that I don't need any of that to succeed in life. And at the time when I was younger, I think because we were so heavily in it, the way I would describe it, I wouldn't say I'm anxious or I'm stressed. I would just say, oh, Mom, I can't breathe, or I don't know what's happening, because I was too young to kind of really understand it all. And I think at the time, my mom was just trying to, I think, make it as lighthearted and just be like, it's okay, we'll move on. You just go and dance and you'll be okay. And I think now what's interesting compared to when I was younger is the anxiety that I've gone through now is the same that my mom deals with. We deal with it exactly the same, and we're able to kind of help each other out in a similar way, which is really awesome. And whenever I'm going something, I call my mom and she knows exactly how I'm feeling because she's actually gone through it at the same time as me. So it's really cool that we're there for each other and we make each other feel really safe.
This is really interesting. This common thread keeps coming through from all of you guys, that you are constantly, Hallie, you've spoken about it, Maddie, you've spoken about it, you're constantly going back to family, you're going back to close friends that has maintained your space. I want to get into some practical tips for people, because I think therapy is awesome, but it's not available to everyone, right? It's still very expensive. Most of us have had the privilege of being diagnosed or have access to their resources, but many don't. For me, my mental health journey is going on crazy runs. If I'm going through something, I'll run myself till I have no more energy anymore and I can't have negative thoughts. Ricky, what is it for you when the cameras are not on and you're not entertaining others? How are you kind of managing your own mental health?
I just love spending time with my friends. Honestly, when the cameras are off, I just call my friends, we meet up, we watch movies together. I love surrounding myself around beautiful, positive people. I think when you have a really good support system and a good group, everything is just amazing.
Halima?
I think what I've learned is when it comes to mental health, you have to be your biggest advocate. And I'm not going to lie, we're talking about how, therapy isn't available to everybody. But even for me, financially, I've gotten to a place where I can't afford it. But what I'm having trouble with is finding the right therapist that is culturally aware, that understands what it was like to have childhood PTSD, because that's something that I'm just now unpacking and learning about myself. And it's so hard. It's a delicate balance, finding the right professional to trust. But it's one of those things like dating. Sometimes you just got to go for it, have 3 lined up and see which one that works, see who you connect with. And the first one might not work out, just like boys. It's like books, right? Put it back in the shelf, try another one. Same thing with therapy. And when it comes to finding out what works for you. So what I found is, where I necessarily didn't have the best luck finding the right therapist, it's a journey I'm still on. What has helped me is trauma bonding, finding fellow Somali refugees that were children that left their camps and moved to a country like America, grew up in all these family dynamics and all these cultural barriers, and seeing how they overcame honestly helped me navigate my own journey when it comes to mental health. So it's about finding what works for you. And, mental health is such a broad topic that not everything that works for so-and-so is going to work for you. So make it individualized and just go for it.
You are so right. Therapy is just like a relationship, right? And the more you give in those sessions, the more you get, the more you receive. You've got to be vulnerable. You've got to open up. I want to open up a question that's come in from the audience. And if you guys are watching live right now, you can add a question in the comments section and we'll try and address it. This is from Harmony, a freshman at Spelman College. And it's an open question to the panel. Through the media and your own personal thoughts, how do you stay true to yourself and find the courage to be unapologetically you? How do you find the courage to be unapologetically you? It's such an interesting idea, right? That how do you be brave enough just to be yourself? But it's so true. Anyone want to take that one?
I feel like being yourself is so much more less exhausting. You don't have to put any effort in being who you are. And I know we've all have done it. If we're with a group of friends or we feel like we kind of stick out, we even try to laugh a certain way, try to hold our head a certain way, make jokes a certain way, but it feels draining and exhausting because it's not you. So I feel like it's more effortless when we're ourselves. Yes, it's more difficult and it's weirder and harder for people to accept us for who we are. But at the end of the day, it's less draining for us. And, that's what I do. I'm like, okay, if I just am myself, I don't have to play a character. I don't have to play a role. I don't have to think about in my head, oh, what did I say to this group of people? Or what did I say to this group of people? I'm just being.
Yeah, 100%. Somebody asked me the other day what the definition of cool was, and we are trying to work it out. And I think it is that. It's about being as comfortable as you can in your own boots. Anyone else got anything else you'd want to share on that particular idea, on being unapologetically yourself?
I mean, I think Chloe articulated that so beautifully. And it's that simple. Everybody else is taken. So be yourself, be unapologetically you, and the right people, they'll fall in love with you for that. So yeah, I always say, what I tell myself is, don't change yourself, change the game. Just be proud of who you are, be proud of where you came from, wear it proudly, and go into spaces knowing yourself.
So I just went for therapy for the first time a couple months ago. First time ever. And in my culture, it was a very big taboo, a very big stigma to kind of go. And the one thing that I took out of it was that it just felt so good to get some stuff out that I never said out loud. And this is an open question to the panel, what is the one thing you got out of therapy that you wish you knew before you went in, that, other people, you wish they knew about that experience? What did you learn?
Okay, I'll go first. So all my life, I was always taught, lead with kindness, be a kind person. Life, deals us difficult cards, but you don't let that phase you. You remain a kind person. And what I learned in therapy, I have so much anger from my childhood, from the injustices I've seen, from so much, growing up here in the West and being the only hijab Muslim girl in so many spaces. And I've learned that it's okay, but now we have to heal. You got to heal past the trauma. You can't get stuck. So I learned that it's okay to have those feelings, and it's okay not to be okay, because that was something that I was always taught, like, have a smile on your face. Even if your world is falling apart, just fake it till you make it, put on a big smile, put on your big girl pants, and, just keep going. And what I'm learning now is we really have to unpack the childhood traumas that we've been through. And sometimes it doesn't have to be like an extreme, like, this happened to me, but it can be something that somebody said to you when you were a small child that made you feel insecure in some way. And learning that it's okay to have those feelings, but now we got to unpack,
Often, a lot of people are really busy. You guys are exceptionally busy, but everyone that's watching is busy. They're busy with school, with college, with family life, with all kinds of stuff. And we sometimes struggle to make me time where I'm just going to focus on me. Hallie, I've spoken to you about it in the past. Like, what does me time look for you? Is it your favorite facial? Where does it get good?
Yes. Well, for me time is spending a lot of time in nature. So today is Saturday, for example, and my plan is to go to the beach and to just lay in the sun and to just remind myself of all the beautiful things that surround me and what I'm thankful for. And it's so interesting because, speaking of this therapy conversation, I'm going to see a therapist for the first time on Monday. And I'm like so excited, but I'm also so nervous because, I'm so used to, like Halima and Chloe were saying, you just put on your big girl panties, you just suck it up and it'll be fine. And, I realized that I kind of hold a lot of things within. And so sometimes that has led me to not know how to voice my feelings a lot. And so I keep it inside and not tell people how I truly feel. And so that's why music has been so therapeutic for me, because that's the one place where I can put it somewhere and for it will matter and nobody judges that. So for me, I feel that making time for myself in nature is where my happy place is, as well as writing all my feelings down so that I know that something is in there, I can just get it out somewhere where I can see it and be like, you do feel, you don't have to numb yourself out. You don't have to act like it doesn't exist and that these feelings don't. And they are so important to you. So I think that's mine. Yeah.
That's really interesting. I saw somebody on Snapchat Spotlight recently that wrote their negative thoughts down on their hand, and then they washed it away. They literally cleansed themselves of that idea. Another question that's come in from the audience that I'd love to throw to you guys: what do you say to yourself, or do you say to keep positive in your mindset? What do you say to yourself in terms of your affirmations to stay positive? Ricky, I think this is probably a good one to start with you.
Well, what do I say to myself? I just usually just when I get up in the mornings, one thing I always do is always go to the mirror and I just stare at myself and I just appreciate everything about me. I'm then I started reminiscing about times where I wasn't very confident in myself. And I'm like, wow, I'm here right now. I'm alive. I'm well. I'm beautiful. And I constantly keep telling myself that. And it actually really does work. And each and every day, I realize something new and something amazing that I love about myself. So I always tell myself that I'm beautiful. I'm amazing. I can conquer anything I'm going through today. I can get over it tomorrow. And since I keep doing that, it actually really does help. So that's what I say to myself.
Halima, and then making our way around the room, what's your guys' positive affirmations to yourself?
I mean, I kind of said it earlier, but don't change yourself, change the game. Meaning, don't feel like you have to conform to fit the mold. Just be who you are, and that's enough.
Maddie?
Yeah, I mean, I agree with both of them. And I think something that I have been saying a lot, and it really does, I don't know if this would help everyone, but it definitely helps me, is just saying this is temporary. It's something I'm constantly reminding myself. And in moments where I feel like it's never going to end, or I feel like I'm in a really anxious state, I just have to remind myself that it's temporary and we're going to move on, and it's something I'll be able to get through.
If it's not okay, it's not the end. Chloe?
Something I tell myself is to just keep my head up high, and that, to kind of bounce off of what Maddie said, nothing lasts forever. So that crazy feeling and that horrible low space that you're in, it'll pass. And I think as long as we just have the proper outlets to just kind of get our emotions out so we're not holding it in and we explode later, I think we'll be okay.
Hallie?
Yes, I think for me, I like to remind myself that my story has already been written, and that there is such goodness that is ahead of me, and such greatness that is in my future. And so I don't want to dwell on whatever negative moments I feel or doubts that I feel. And I have to remind myself that I am enough, and that I'm here for a reason, and that this moment in time right now is for a reason, to get to the greater good on the other side. And I will be so proud once I see what that is. So I think that's mine.
You guys are all loved. You are strong. We appreciate you. I remind myself that it is close friends like you guys that, give me strength. And I can't thank you enough for this amazing conversation. Guys, don't stop. The conversation's just getting going. We're going to be having some amazing breakout sessions. You're simply going to click the back button, and you're going to go down to the bottom left of the screen and click on the breakout button in the lobby. We'll see you guys there. Thanks so much.